Hi, welcome. My name is San, and my goal is to bring useful information to you so you can have the best health outcomes possible. So let's get started. So targeted therapies is a quite a broad topic actually. Targeted therapy means that it's the treatment is targeted towards certain types of cells or hormones that would have an impact on those particular type of cells because that's where the cancer is housed. So it destroys the cancer cells, or it stops those cells from growing, or it stops the flow of blood to those particular tumor cells so that it can starve the tumor, or it can deliver cell killing substances into the cancer cells. So it's actually going into the cancer cell and attacking those cells, or it is starving the cell of the hormone that is being used to feed that particular cancer. Okay, there are a lot of, so as you can see, for many cancers, there are targeted therapies. Now, why targeted therapies? Because in targeted therapy versus chemotherapy, in chemotherapy, it's being given systemically, which means it's given to the entire system. So there is impact on the entire system. But if it is targeted therapy, then it is targeting those specific cancer cells or those types of cells. So the impact is much more focused, and the side effects are much lesser when we do targeted therapy. That's why there is a move from chemotherapy towards targeted therapy. Okay. Now, in the case of targeted therapy, it actually depends on the specific therapy you're given. The side effects would depend on that. But there are some common side effects or risks that are there with it. There's always, with most treatments, it is going to impact our energy. So there is a risk of fatigue, there is risk of infection, there is risk of bleeding with most treatments. There is also, because we're getting these therapies, there is risk of impacting the GI system. So whether that's nausea, diarrhea, taste change, constipation, those are all side effects that are common with these different treatments. Also, any fast growing cells, so nail changes, skin changes, hair changes, those are also things that can happen. Now, in certain types of targeted therapies, it can affect, it's going through your blood vessel. So it could have an impact on the blood vessel. So there could be impact on blood pressure. So you will want to look at your particular therapy that is being given, and does it have any risk of high blood pressure or low blood pressure. In that case, you'll want to keep an eye on that, monitor that for yourself. Okay, and then also if there are risks of blood clotting associated with that particular treatment, so then you'll want to keep an eye out for the indications of that. If you're a candidate for it, they're going to do screening and determine if you are the right candidate for that treatment. Now, in terms of how and where it is given, it's generally given in your provider's office or at the cancer center. So in the clinic, how often is determined by the treatment protocol itself. So that will determine how often it is given. The risk here is that in some cases you may become resistant to the treatment. So it was working for a certain period of time and then it's not working anymore after that. So that can happen in some cases, or if it is being given for a long period of time, that could happen. Also, because these are newer treatments, some of these treatments are quite expensive, so there is a high financial toxicity risk with this. So you'll want to look and make sure that it is covered by your insurance and there is sufficient financial support for these kind of treatments. Because these are newer therapies, long-term effects are not fully known. So important to track and monitor your health. And if you're feeling anything, even a year or 2 years later, important to get that checked out. Also at home, it should be treated as a hazardous drug. So keep it in a safe place. So What I suggest is now, if you are getting any targeted therapy, understand what therapy you're getting, why you're getting it, how you're going to be getting it, what are the things you need to know, have your side effects and the expected issues mapped out, have that information written out, know what you're going to do about it, have information about your medical team so that you can get it addressed, get your provider to know about your other health issues and medications so that everything is on track. Thank you for watching. If you would like to know about more content along these lines, then hit the subscribe button and the notification bell so you'll be informed when we create more. If you like this video or you have some thoughts to share, then please comment and hit the like button. And you can always reach us on our platform and the different sites which I've put in the description below. Thank you, and my best wishes to you on your healthcare journey.